So just to provide some background, serum neurofilament light chain is an emerging biomarker of neuroaxonal injury and neurological disease. So neurofilaments are neuron-specific cytoskeletal proteins, and they're released into the extracellular space when a neuron and their axon is damaged. And recently developed immunoassays that are highly sensitive allow us to detect these proteins in the blood of people with neurological diseases. So serum neurofilament light chain there's a lot of interest in serum neurofilament light chain as a biomarker in this context. But one of the important things is to establish reference ranges in order to be able to determine what is within a normal range and what is an abnormal value for neurofilament light chain. And one of the important challenges is that neurofilament light chain increases with age. So this is very well described. And so you can't just have a uniform reference range. It needs to be age specific to some extent. And so based on this, there have been a number of reference ranges proposed. And in this study, we aim to assess the agreement between 6 published reference methods applied to a large population of people with MS. So we measured neurofilament light chain in about 7,000 people with MS. And this is a longitudinal study that is ongoing. And so we had 13,000 blood samples and neurofilament light chain values. And we assessed, when applying these normative cutoffs from 6 different reference databases, what proportion of the population was classified as having abnormally elevated NfL. And this was based on a 95th percentile cutoff based on the controls. And each reference database utilized a little bit of different methods kind of to adjust for age, but all of them did take age into account in the calculation. And so what we found was very, very interesting, and it was that there were markedly discrepant results when applying different reference populations. So the proportion of NfL values that was classified as being abnormally elevated ranged from 3.7% to 30.9%. And I think that this is very important, especially now that NfL is actually available for measurement commercially, and so people can start ordering this test. And this raises the importance of caution in interpreting, especially a single NfL result, and the importance of accounting for additional factors. And so one of the issues here is that these were all kind of somewhat different populations that had been in which these reference ranges had been determined. And very importantly, in addition to age, there are other factors that are associated with elevated NfL, including comorbidities such as renal dysfunction, diabetes, smoking, alcohol use. And so it is important to determine also if the population from which the reference range has been derived is actually representative of the population that you are studying, the population with a neurological disease. One additional issue also that I think is very important is the method of measurement here. So all of these reference ranges are not on the same platform. So there are a few different platforms that are used for measuring neurofilament light chain. And also the biological matrix in which NfL can be measured can be either plasma or serum. And the values are a little bit different. So serum generally has been reported to have higher NfL values than in plasma. We had a large number of patients who had samples measured with both serum and plasma, and with different measurement platforms as well. And so we were able to convert between the two. But that might be an additional factor contributing to the variability here, the fact that all these reference ranges have not been determined in the same biological matrix and measurement platform. And that is another important kind of future direction that moving forward, we need to better understand how platforms and how biological matrices may differ, and ensure a standardized procedure for measuring and reporting NfL, and making sure that we have an interlaboratory conversion that is accurate as well.